Most men over 60 are making at least one mistake every single day that's quietly damaging their prostate. Not because they're careless, because nobody told them. And the worst part? Some of these mistakes feel completely harmless. Normal, even. That's exactly what makes them so dangerous. So before you do anything else today, you need to hear this. I am Dr. Natalia de la Cruz. And if you want to keep receiving important content about health after 60, subscribe to the channel and turn on the notification bell. Now let's get into it. Because this isn't just about discomfort or urgency. Left unchecked, these mistakes can turn a manageable situation into something far more serious. And most men don't find out until the damage is already done. Here's the first mistake, and it might be the most common one of all. You're not drinking enough water during the day, so you stop drinking water in the afternoon on purpose, thinking it'll help you sleep through the night without running to the bathroom. It makes sense on the surface, but here's what's actually happening inside your body when you do that. When you restrict fluids, your urine becomes highly concentrated. That concentrated urine is more acidic, more irritating, and it sits in the bladder with fewer flushes happening throughout the day. Over time, this creates a toxic environment for your urinary tract and your prostate gland. The prostate is surrounded by tissue that responds to chronic irritation. Persistent irritation leads to inflammation. Inflammation leads to swelling. And swelling leads to all the symptoms you're probably already dealing with: the frequent urge, the weak stream, the feeling that you never fully emptied out. The fix isn't to drink gallons of water. It's to spread your intake consistently across the day, taper off around 2 hours before bed, and make sure your body stays hydrated at a cellular level. Water is one of the most powerful tools you have for managing prostate health, and most men are using it wrong. Now, here's where it gets more serious. Mistake number 2 is something almost nobody talks about, and it has to do with what you're eating for breakfast. Specifically, processed foods that spike inflammation before your day even starts. White bread, packaged cereals, fruit juices labeled as healthy, these aren't just bad for your waistline. They create a cascade of inflammatory signals throughout your entire body, and your prostate is one of the most inflammation-sensitive organs you have. Chronic low-grade inflammation is now recognized by leading urologists as one of the core drivers behind benign prostatic hyperplasia, which is the medical term for the prostate enlargement that affects over 80% of men by age 80. When you feed your body inflammatory foods consistently, you are essentially pouring fuel onto a fire that's already burning in that gland. The smart swap? Start your morning with protein, healthy fats, and whole foods: eggs, avocado, Greek yogurt, nuts. These choices reduce the inflammatory load on your body before your day even begins. And here's a question most men never think to ask themselves: how long have you been sitting today? Mistake number 3 is sedentary behavior, specifically extended sitting, and it's destroying prostate circulation in silence. When you sit for long periods, you compress the perineal region, which is the area between your scrotum and your rectum. That compression directly restricts blood flow to the prostate. Without consistent blood flow, the gland can't flush waste products efficiently, it gets congested, and congested tissue becomes inflamed tissue. Studies have consistently shown that men with more sedentary lifestyles have significantly higher rates of prostate enlargement and urinary symptoms compared to men who stay active. And this doesn't require intense exercise. Walking 30 minutes a day, standing up every hour, doing basic pelvic floor exercises, these simple actions dramatically improve circulation to the prostate and reduce congestion. But don't stop here, because mistake number 4 is one that genuinely shocks men when they hear it. Most men are taking over-the-counter cold medications, antihistamines, or decongestants without realizing that these drugs can make prostate symptoms dramatically worse overnight. These medications contain ingredients like pseudoephedrine and diphenhydramine, which have a direct effect on the smooth muscle tissue of the bladder neck and the prostate. They cause tightening. They reduce your ability to fully empty your bladder, and in men who already have some level of prostate enlargement, they can trigger something called acute urinary retention, which is a complete inability to urinate. That's a medical emergency. If you're over 60 and you have any prostate symptoms at all, you should never take a cold medicine, a sleep aid, or an allergy pill without first checking with your doctor or pharmacist about whether it's safe for your specific situation. This is one of those mistakes that can send you to the emergency room, and still, most men have never been warned about it. Now let's talk about something that happens in the bedroom. Mistake number 5 is irregular sexual activity, and this one cuts both ways. Some men over 60 stop having sex or masturbating almost entirely, either because of physical changes, a lack of partner, or simple loss of interest. What they don't realize is that regular ejaculation plays an important biological role in prostate health. The prostate gland constantly produces secretions. Those secretions need to move out of the gland regularly. When ejaculation is infrequent, those fluids accumulate, stagnate, and create the exact kind of environment where inflammation and even cellular abnormalities can develop over time. Harvard researchers found in a major long-term study that men who ejaculated more frequently had measurably lower rates of prostate cancer compared to those who did so less often. This isn't about pleasure as a luxury, it's about physiological maintenance of a critical gland. If this is something you want to explore further, there's a practical resource I want you to know about: the medical guide to avoid the mistakes that damage the prostate after 60 is available in the pinned comment below this video. It goes deeper into how sexual activity, lifestyle habits, and daily choices directly affect your prostate health and what you can do starting today. Back to the mistakes, because we're only halfway through. Mistake number 6 is something that happens in the kitchen, specifically with what most men believe is a healthy part of their diet. Red meat, particularly processed and charbroiled red meat, contains compounds called heterocyclic amines and heme iron, both of which have been repeatedly linked to increased prostate cancer risk in long-term population studies. Men who eat red meat daily, especially grilled or heavily cooked red meat, show consistently elevated inflammatory markers and higher rates of prostate-related complications. The scary part is most men are eating red meat multiple times a week without a second thought, and their doctors aren't always connecting the dots for them. That doesn't mean you need to become a vegetarian, but replacing 2 or 3 red meat meals per week with fish, especially fatty fish like salmon and sardines that are rich in omega-3 fatty acids, can meaningfully reduce prostate inflammation over time. And while we're talking about diet, don't overlook this next one. Mistake number 7 is too much alcohol, especially beer. Most men know alcohol isn't great for their liver, but very few know that alcohol has a direct and significant effect on the prostate. Beer in particular is high in phytoestrogens, plant-based compounds that mimic estrogen in the body. As men age and testosterone naturally declines, estrogen levels tend to rise. When you add alcohol-derived phytoestrogens on top of that hormonal shift, you accelerate prostate tissue growth. You're essentially adding hormonal fuel to an already changing gland. Even moderate alcohol consumption, defined as 2 drinks per day, has been shown in studies to increase urinary symptoms in men with benign prostatic hyperplasia. That nightly beer or glass of wine that feels relaxing might be making your night trips to the bathroom more frequent than they need to be. Here's a simple question: when was the last time you had a PSA blood test? Mistake number 8 is skipping or delaying routine prostate screening. This one isn't about a habit or a food choice, it's about avoidance. And avoidance is one of the most dangerous things a man over 60 can do with his health. The PSA test, which measures prostate-specific antigen levels in your blood, is the earliest warning system we have for detecting prostate abnormalities, including cancer. Prostate cancer in its early stages almost never causes symptoms. You feel fine, you think everything is okay, and then it's not. Men who get screened regularly and catch early-stage prostate cancer have survival rates that are close to 100%. Men who avoid screening and discover it later face a very different reality. If you're over 50 or over 40 with a family history of prostate cancer, you should be having a conversation with your doctor about PSA screening. That conversation might save your life. Not, maybe, might. And that's worth a phone call. Now let's talk about sleep, because this connection is one most men completely miss. Mistake number 9 is chronic sleep disruption, and it's fueling prostate inflammation in ways that the research community is only recently beginning to fully understand. During deep sleep, your body undergoes critical repair processes. Anti-inflammatory cytokines are released, cellular damage is addressed, hormones are rebalanced. When you consistently get poor sleep, less than 6 hours, or fragmented sleep from frequent nighttime urination, your body never fully completes these repair cycles. The inflammatory state that was building during the day never gets properly resolved. It compounds, night after night, week after week. Here's the part that creates a vicious loop. An enlarged or inflamed prostate makes nighttime urination more frequent, which disrupts sleep, which prevents the body from healing the prostate. Most men try to address the sleep problem without addressing the prostate, or address the prostate without addressing the sleep. You have to work on both simultaneously. Sleep hygiene, limiting fluids before bed, avoiding alcohol and caffeine in the evening, and addressing the underlying prostate inflammation through diet and lifestyle all work together. Mistake number 10 is one that almost no man wants to hear, but it might be the most important one we've covered. It's ignoring stress, not dismissing it, ignoring it, thinking it's just part of life, thinking tough men don't let it get to them. Here's the biological reality. Chronic stress keeps your body in a persistent state of cortisol elevation. Cortisol is your primary stress hormone, and in high sustained levels, it does something very specific to your prostate. It triggers androgen receptor activity in prostate tissue, which promotes cell proliferation. In plain language, chronic stress tells prostate cells to divide and grow more than they should. Research from major cancer centers has confirmed that men with high chronic stress have measurably worse prostate health outcomes, faster progression of benign enlargement, and higher inflammatory markers in prostatic tissue. Stress isn't just mental, it's physical, it's hormonal, and it's directly, measurably affecting your prostate right now if you're not managing it. The good news is that the solution doesn't require therapy or medication if you're resistant to those. Even 15 minutes of diaphragmatic breathing per day has been shown to meaningfully lower cortisol levels over a 4-week period. Walking in nature, physical activity, consistent social connection, these are all cortisol regulators with direct anti-inflammatory benefits for your prostate. Now let's add one more because this one is coming up more and more in clinical settings. Mistake number 11 is ignoring pelvic floor health. Most men don't even know they have a pelvic floor, but these are the muscles that support your bladder, prostate, and rectum. When they become weak or uncoordinated, which happens naturally with age and sedentary lifestyle, urinary control suffers, sexual function declines, and the pressure dynamics around the prostate gland change in ways that accelerate enlargement and inflammation. Pelvic floor exercises, specifically Kegel exercises adapted for men, are one of the most evidence-backed interventions for reducing urinary symptoms in men with benign prostatic hyperplasia. Multiple clinical trials have shown that consistent pelvic floor training can reduce nighttime urination frequency, improve stream strength, reduce post-void dribbling, and even improve erectile function. And yet almost no man over 60 is doing them because nobody told them it was relevant to them. To do a basic Kegel, identify the muscles you use to stop urinating midstream. Contract those muscles for 3 to 5 seconds, then release fully. Do 10 repetitions 3 times a day. That's it. Simple, free, and if done consistently over 8 to 12 weeks, the evidence says you will notice a difference. Now here's the most important thing to understand as we bring all of this together. None of these mistakes alone is going to destroy your prostate health overnight. But most men over 60 are making multiple mistakes simultaneously, stacking them on top of each other, day after day, year after year. The results are cumulative. The damage builds quietly, and by the time symptoms are severe enough to demand attention, the problem has usually been growing for years. The good news, and there is genuinely very good news here, is that the prostate is a responsive gland. When you reduce inflammatory inputs, improve circulation, restore hormonal balance, and give your body what it actually needs, the research consistently shows that symptoms can improve significantly. Men have reduced their nighttime urination frequency by 50% or more through lifestyle changes alone. Men have lowered their PSA levels measurably through dietary and behavioral interventions. Your body wants to heal. You just have to stop working against it. So let's bring this home to the question we started with. Are you making mistakes that are quietly damaging your prostate? If you've watched this far, the honest answer is probably yes. Most men are. Not because they're negligent, because they were never given clear, accurate, practical information. That's exactly what this channel exists to do. Start today with one change. Pick the mistake that resonated most with you and address it this week. Drink more water consistently. Cut one processed meal. Walk 30 minutes. Do 10 Kegels. Book that PSA test you've been putting off. These aren't dramatic changes, but compounded over weeks and months, they add up to something that really matters. A healthier, more comfortable, more functional life. If you want a complete, organized guide to protecting your prostate after 60, the medical guide to avoid the mistakes that damage the prostate after 60 is waiting for you in the pinned comment below this video. It covers everything we talked about today and more in a format you can actually use. And if this video gave you information you wish you'd had sooner, do one thing before you go. Subscribe to this channel and turn on the notification bell. Because this is exactly the kind of content we publish every week. Real information, clear explanations, no scare tactics, no false promises, just what you actually need to take care of your health as you age. You deserve to have that information, and we're going to keep delivering it.